my name is Bianca Nunez, and I'm a full-time nursing student at Nevada State College, and I'm here today with my professor Marcellus. Today in room B, I have patient Monique Rogers. Her date of birth is 9/10/87. She is a 32-year-old female that came in today for headaches. So a little bit of background for the patient. The patient is currently experiencing a throbbing headache. In the past, she has had headaches before, so for about a few times a year, but she's never been diagnosed with migraine headaches. She doesn't have any medical illnesses. As for family history goes, she doesn't have anybody in her family who has history of migraine headaches. Her occupation is a licensed practical nurse, so she does work on the computer for multiple hours, and she claims that it does affect her vision because it causes those headaches to occur when she reads a lot of small print. The patient is not a smoker or a drinker. The patient does have some stress in her life in and outside of work, and she notices she tends to get those headaches when she does stress out. As far as assessments go, we did a few of them. So we assessed her vitals, her head, her neck, and her heart. For her vital signs, her temperature was 98 degrees Fahrenheit, her respirations were 18, her blood pressure was 130/80, her pulse ox was 98, and her pain was a 7. The patient appeared to be alert and orientated ×3. The patient does not have any known allergies present at this time. When I assessed her head, I did some inspecting and I did some palpation to see if there was any lumps, masses, or lesions. Her hair appeared to be full and equally distributed with her eyebrows and her eyelashes. Her hair was brown. She did have some tenderness after I was done palpating her head where she was having her headache, which was in the back of her head. As for another assessment I did with her, for her lymph nodes in her neck area, she didn't have like any swelling, masses, or lesions. I did perform a range of motion test. She followed everything as I directed. She didn't have any issues with range of motion. Another thing I did with her was I checked to see her trachea and her thyroid to see if they were evenly distributed and there was no abnormalities of enlargement, and there was none noted. I also checked her spine. Her spine appeared to be symmetrical. There was no tenderness when I palpated her spine as well. As for her heart and neck vessels, I palpated the catheroid arteries, and they were pulsing and +2. I didn't notice any jugular vein distension when she was laying down in a supine position. I checked her apical pulse. Pulses were pulsating as well, 2+. When I did her assessment to see how many pulses per minute she was having in her apical pulse area, it was 90 beats per minute. I auscultated the aortic, pulmonic, the Erb's point, the tricuspid, and the mitral valves with the bell and the diaphragm, and she didn't have any murmurs or bruits present. As well in the catheroid arteries, she also didn't have any bruits or murmurs noted. What I would recommend is the patient to follow up with a neurologist since she is starting to have more frequent headaches. I told the patient, I recommend her to start taking some time to herself, and when she's on the computer for long periods of times, to step away because since it does hurt her. When she does follow up with the neurologist, he can follow up to see if she does have migraine headaches. And that was what we did today. Thank you.